I think we should actually start. People will join us as they come in. So hi to everyone who's here. I'm Anne Paul. I'm Chief Executive of Doctors in Distress, about which a little more in a little while. I will introduce our wonderful panelists in a moment, but I just want to say this book club is a discussion on Rachel's book. You have written more than one, but on breathtaking, and we're going to look at some of the clinical aspects of it, possibly not exclusively, but Richard and Rachel will talk. And the reason we're doing this as the first of a series of book clubs is to introduce people to various writers, and of course to encourage everyone, please, to think about joining as participants for the Wounded Healer in March next year. It is promising to be an astonishingly good conference. This is part of the Restore project. The Restore program is something that's a collaboration between Doctors in Distress, PH, and the bigger picture. And it looks very much at how healthcare workers all across the country can find creativity, connectivity, and contemplation in the creative arts. I know, Rachel, you're going to talk a lot about the power of expressive writing and how writing can help heal anxiety and process challenging thoughts. It's a huge honor to have you. So just a few minutes more of housekeeping. The format is a webinar. I need to say we're recording this, so please be aware of that. We're going to ask everyone, please, to use the Q&A, send us your questions. The format is going to be Richard and Rachel will have a chat. I think that's going to get the Q&A going completely crazy, and we'll open. The thing I will do is close by 7 o'clock at the latest, a hard stop. So it is my enormous pleasure to introduce you, Richard. I'm not going to talk about you. I'm going to leave you to introduce yourself. There you go.
Thanks so much, Anne. Hi, everyone. I'm Richard Duggins. I'm a clinical lead for NHS Practitioner Health in the North East and Cumbria. I'm a psychiatrist and a psychotherapist, and I'm really thrilled to be here. And a big welcome to everyone for our second Wounded Healer Book Club for health and social care professionals. As Anne said, these book clubs are part of our preparation for the upcoming International Practitioner Health Summit, the Wounded Healer Health, Hope and Healing Beyond COVID, and that's on the 17th to the 18th of March next year. And over the next few months, these book clubs, in these book clubs, we have the privilege of featuring authors like Rachel, who will be speaking at the conference. I'd like to just take a little moment to say something about NHS Practitioner Health. In my opinion, it's an outstanding service. It's a free, confidential NHS service for any health professional. We offer advice, support and treatment to any health professional who's struggling with their well-being. We offer a wide variety of well-being advice and well-being support too. And please just have a look at our website for the vast range of things that we do now offer. In England, NHS Practitioner Health is open to any member of health or social care workforce, either via self-referral or via the new staff mental health and wellbeing hubs. In Scotland, all regulated health and care professionals can access us. NHS Practitioner Health, as you might imagine, has seen record numbers accessing our service in the last 12 months. The people who are now coming to us are increasingly reporting feeling exhausted, overwhelmed, and struggling to get on top of their workload. The pandemic has taken its toll. And as we see the country opening up and a focus on reducing waiting lists, it may feel, and I think it does feel to many staff, that there's been no time to have a break, no time to reflect before this next challenge approaches. So if you feel like your psychological health has taken a battering, or and if you feel like that, or someone you know feels like that, please just get in touch with us. I'm now going to hand you back to Anne.
Okay, and just carrying on in that vein, and everything you say, Richard, is so true. the mental health and well-being of the medical workforce in the UK is challenging, to say the very least. So Doctors in Distress was started in 2019 by Amanda Sidhu, following the tragic death of his brother, Dr. Jagdeep Sidhu, who was a cardiologist, and got to the point of burnout where he felt he had no other option, no other way to escape his suffering. If I say anything that about Doctors in Distress, it is that we don't want anyone ever to feel that alone again. So we're committed to reducing the prevalence of burnout and suicide among the whole medical profession. And we're not just for doctors, we work right across the workforce. We aim to change the stigma that continues around the mental health, change behaviors and cultures. And of course, we want to promote the value of good leadership. We work really closely with Practitioner Health, and we're so proud to be the chosen charity of the Wounded Healer Conference next year. So we're there to help to alleviate pressure. We offer support groups. I'm not going to take up time on this very precious webinar to tell you more, but I urge you please to look at our website. And I will say that we're an independent charity. It's one of our strengths, but it also means that we rely entirely on donations. And I would urge those who can, please, to support us. And the donation link will pop up every so often on the chat. Okay, now it's my huge pleasure to introduce you, Rachel. And again, I'm not going to say anything, but I will take the chair's privilege and ask you please to mention in your introduction, which you wrote this book right at the start of the pandemic. And it struck me, continues to strike me, how you must have been feeling when your husband, a pilot, was still flying in from Lombardy in Italy. And the other thing for me personally was how you described writing in the depths of the night and how that was a release for you. So Rachel, over to you.
Thank you so much for inviting me. What a brilliant charity Doctors in Distress is, and what a brilliant service PHP is. I think just both couldn't be more important at the tail end of 2021, with even today news of a worrying new strain of COVID coming from Southern Africa. It's just, it goes on. And yeah, it seems so long ago now, but in sort of January, February last year, when all of the stories of this strange new disease that didn't yet have a name started to surface, I was particularly concerned because, as you say, my husband's a pilot, and the two places he happened to be flying most of all at the start of last year were China, central China, and northern Italy. And of course, we first of all saw the awful impact of COVID in Wuhan, Hubei province, and then in Lombardy and other parts of northern Italy. And it was really scary to sort of say goodbye to Dad. I have children, and know that he was going somewhere from where these awful headlines were emanating. And things, I think, reached a real pitch of anxiety for me in late February, when we were still not even close to locking down the country, but suddenly numbers were shooting up exponentially in Italy, and it became perfectly clear that this wasn't a strange exotic illness on the other side of the world. This was on our doorstep. And guess who flew back straight from Lombardy? So I, early on at the end of February, had the full house of COVID symptoms. I couldn't get up a flight of stairs without being short of breath, but was forbidden from having a test because there were so few tests then. They were reserved for people who had the right travel history. So I'll never know if I had it or not. So it was incredibly frightening. And I think one of the hardest things was this mismatch between everything that myself and friends and colleagues were all saying face to face or in our sort of feverish little private WhatsApp groups. We were so worried, and the numbers started ticking up and up in London before it arrived in places such as Oxford, where I'm based. And there was this awful mismatch between our fears and what we were starting to see, and this seeming complacency amongst much of the media, the government. It was really frightening. And it was really then that I started developing an insomnia and sitting up late at night, bashing away on my keyboard, even before I saw my first COVID patient, because I knew what exponential meant. And it seemed so obvious to us all that the horrors of Wuhan and then of Lombardy and these unimaginable tales of hospitals rationing ventilators and running out of oxygen, they were coming for us.
Richard, over to you too.
Thank you. Thanks very much, Rachel. So the plan now is for you and I to have a conversation about your book. It's going to last about half an hour, and then we'll open up to Q&A. Is that okay?
Absolutely.
Great. So that's a good place to start. How are you today?
I'm very well today, thank you. Yes, like many people in working in a hospital, we've got patients in intensive care, we've got COVID wards opened up again. It never really went away. But yeah, despite that, I'm having a good day.
And it's a good day for me.
What about you?
It was a good day for me because I get to do this, and I'm delighted to be doing it and meeting with you and seeing what happens. What I thought would be a good place to start our conversation, though, was in the way that you start the book, and you dedicate your book to the memory of 4 members of staff who died at Oxford University Hospitals by the time you wrote the book. And you also remember the many other NHS staff and care workers who suffered the same fate. And you offer heartfelt thanks to them for their courage and selflessness. And I thought that might be a good place for us to start today, really.
Yeah, I think about those people, all the people we know. There's over 1,000 of them who have made the ultimate sacrifice in this pandemic and lost their life as healthcare workers all the time. And I guess that's because even now we are seeing double vaccinated doctors, nurses, other healthcare professionals succumbing again to COVID and losing their lives. There was a case this week of a doctor local to me who probably caught his COVID in hospital and has just tragically died from that disease. A young, fit man, a father. And I think I'll never forget the first COVID patient I saw, because I simultaneously was sort of driven to help them, to use all my skills and training in the best way I could. But at the same time, I felt this powerful desire almost to recoil, because my PPE seemed so inadequate. It certainly wasn't high-level PPE. I didn't know if it was going to protect me. There were no vaccines, no treatments. People were dying everywhere, and I was frightened. But you had to overcome that and do your job. And that's what I saw all my colleagues, everyone around me doing with the utmost courage and selflessness. And I think that was replicated all across the NHS in the most extraordinary way, but with terribly tragic consequences. And I suspect I'm like most people when I say I never imagined that I would be putting my life at risk through becoming a doctor. It's not like becoming a soldier or maybe a police officer, but that's what everyone has had to do. And it's a haunting legacy, which I very much hope will be formally memorialized in time to come.
No, absolutely. I hope so too. You used the word courage, and it's one of the things I thought you showed in writing this book. There's a courage in it, and there's also a kindness in it. And in reading the book, and I listened to it on audiobook as well. It took me back to those first few months of the pandemic, and it helped me digest my thoughts and emotions from that time. And I'm very grateful for that. And I think I didn't realize until reading your book, they were emotions that I think in the busyness of things I had swept under the carpet. And in reading your book, I was tearful quite often. And I wondered, when you look back on those times now, how do you feel?
It's really interesting. When I interviewed other people, I interviewed some of my colleagues for the book. So many of those interviews were occasions where both of us just wept openly as the person in front of me described their own experiences, and they so often said, "This is the first time I've talked about this." And I think there was a peculiarity about the first wave in particular, where we couldn't bear to inflict what we were seeing on our families or maybe non-medical friends, because why would you do that? It was scary enough as it was for the public at large. But equally, how could you talk about your fears or distress to your colleagues because they were in the same boat? Or maybe you perceived them as having an even more traumatic experience at work than you did. So essentially all avenues were closed down. And I remember well into last summer having a conversation with a consultant I work with, and both of us suddenly discovering we were in floods of tears because we hadn't talked to our own little team about what we had all been through. We felt unable to do that. And I think for me, writing that book didn't start as something for public consumption. It was just me articulating into a void because I had to express it somehow, even if I never looked at it again. And I still find now I will have conversations with colleagues at work, maybe for the first time, someone I haven't met before, about their COVID experience. And all of a sudden they'll be in tears because all that raw emotion is still there. They haven't talked to anybody about it. And all of a sudden it just bubbles up in grief and clearly trauma in some cases. And I'm so conscious of the fact that in the immediate first wave, we were all fueled by adrenaline and absolute determination to roll our sleeves up and help as best we could. And that can take you so far. You know, doctors and anyone who works in healthcare, we're very good at suppressing ourselves and focusing on the immediacy of the patient in front of us. But it's really obvious that there's a vast, I suspect almost universal reservoir of trauma in staff, partly because we haven't had people we can talk to, and maybe we don't even think we're allowed to talk about it because those people working in intensive care must have had it worse than me. So I just have to, you know, pull my socks up and crack on and stop being so weak and self-indulgent.
Although, yeah, no, I agree. And that's what I thought was so important about your book, because you do talk about it and you do give other people permission to talk about it. And yes, and to think about it themselves, but also then to talk to other people that they've read your book and this is what you're saying and this is what they experienced. I think it creates a different narrative in the NHS. We're really good at rolling our sleeves up and getting on with it, aren't we? It's what we're trained to do. But there's something else needed as well. And I think your book brings that, and these tearful conversations are needed.
Yeah.
One of the phrases, where you use a phrase in your book where you talk about this first wave was messy, ugly and overwhelming. And there's something, and you talk about documenting the rawness of this time. And I think you do capture that just wonderfully, how messy and raw it was. And you, I mean, I think you said there that this was part of the way that you kept going, writing the book, being up in, I think you said nocturnal therapy.
it literally was that and about 6 cups of tea a night. So no wonder I never slept. It was, and I think it was more than that. I found it therapeutic to simply document fragments of my experience, even if that was into a void. And I think it wasn't that I was trying to be creative or express anything beautifully. I think I needed to bear witness to what was actually happening around me at work. And I think partly I found it therapeutic because there was so much being said about patients, about the NHS, about the pandemic. It was being broadcast relentlessly. It wasn't just the news headlines, it was the news headlines and the footnotes and everything in between. It was relentless. We had the daily death tolls, the sort of horror, the often sensationalism around the coverage. And I think one of the things I found hardest was the knowledge that this person, this human being right here in front of me now, who I knew was not going to survive their COVID. I'm a palliative care doctor. Most of the patients I saw with COVID were dying, but not all of them, but many. I couldn't believe that this individual was replicated 1,000-fold, several thousand-fold across the country, that every single hospital had patients like this patient and this human being, and everything that he or she meant and represented to the world, to their loved ones, this entire human history was being snuffed out in precisely the same way, with precisely the same symptoms and impotence of us, the health givers, all over the country. And so in a way, when I was writing, I think I even felt at the time somehow that I was bearing witness to something that somebody had to document, even if that meant the person still existed. They had probably died by the time I got home and said this happened, but they existed. And it felt, it just felt in a peculiar way, and I don't want this to sound grandiose at all, but it almost felt like I was honouring or trying to say to myself, every single person matters. And there was that awful narrative that still persists, that it's only people with comorbidities who are dying. It's only old people who are dying, as if somehow there were 2 tiers of patients, the ones worth saving and the ones we could just dispense with. And writing for me was an act of defiance against that horrible division of society that I think many commentators and you know, some politicians were at ease with. I most definitely wasn't.
Yeah, but bearing witness is very powerful in your book, and the humanity of our work and the common humanity of all of our patients and our colleagues. Yes, it comes across so strongly. I was one of the things that interested me a lot in your book is you talk about the pandemic, and a lot of people talk about the pandemic at the beginning as a potential apocalypse, as this, and you talk about the kind of derivation of apocalypse as it doesn't mean catastrophe. You said it means an unveiling or a revelation, and I was partly thinking about what you've just said, but there's more. What do you think the catastrophe of the pandemic has revealed to us, if anything?
Well, for me, something pretty electrifying in those first couple of months, and this was just the immensity of that outpouring of desire amongst almost everyone in the country to help out and do their bit and support the most vulnerable. It was as though we'd kind of ripped up all the things that usually divide us and said, right, how can we help? And that might be setting up a WhatsApp group on your street so that people got their medicines or food delivered if they were shielding, to somebody going into work in ICU every day, even though they knew they would be exposed to a virus that might kill them. That just that the whole country seemed to erupt into this kind of grassroots outpouring of kindness and positive, helpful action towards each other. And I know that we can argue that changed quite quickly, and there's so much division and toxicity and hate now around various aspects of this pandemic, but that doesn't mean it wasn't true. And it blew my mind that that was our first instinct. In a crisis, you step up, and everyone stepped up and they did their bit. And something I heard over and over again from people who weren't working in health was this lament, I wish I could do more, I feel so helpless, I want to do more. And that was astonishing to me. That was revelatory. I've never lived through anything quite like that in my lifetime. And the other thing that was revelatory is, in these truly horrific circumstances, almost every day at work, I felt as though I was witnessing the absolute best of human nature, people being so brave and so kind and so determined to help each other. And I felt in many ways so incredibly lucky to be working in a hospital, because I got to see that every day. I had the purest antidotes to those awful, relentless daily statistics, which was this daily dose of ordinary human beings, not heroes, not angels, just ordinary people like us, doing extraordinary things because the situation demanded it and they wanted to help patients who were gravely unwell. And again, I had not lived through anything like that, and I carry that through with me now. It sort of burns in me now as evidence of something that is remarkable, and no amount of sort of crazy anti-vaxxer hate on social media will ever diminish that is in people. And I think it's delightful to me that exists.
Yeah, and that is, although the book is very sad and records terrible episodes, there's also this joy in it. And I think that's what you're talking about when you talk about these revelations. And towards the end of the book, you say one of your experiences from this is you think, well, people are fundamentally good. And I was thinking about what you were saying there, that this kind of outpouring and the whole community rolling their sleeves up at the beginning, but also the what you describe about staff, ordinary staff, and the remarkable things that they do, and you saying we're dealing with people with a frightening disease where we want to go away from them, but actually staff going closer to them in their moment of need, and sitting with people, holding people, and all the various things that you bring. I think you talk about pinpoints of light in the darkness, and that is so there within your book. And there's just these wonderful examples that you talk about Mandy's knitted hearts, and one person that stayed with me was Sana, the medical student, who was having this conversation with a family that was just so moving, and how she did the liaison. There is these wonderful things that you record, and are so important that they are recorded, I think.
Totally. And I wanted the public to know that was happening all the time, every day, because it was such an alien world for anyone who wasn't there. I found the outside world of lockdown alien. It was completely weird to me. I didn't really have an experience of lockdown at all, but for people who never crossed the hospital threshold, They just didn't know. And the fear that I think accompanied the not knowing, the fear that maybe their loved ones were dying alone in bleak and unimaginable circumstances, and nobody was trying to convey humanity. I desperately wanted the public to know how important that was, how much it mattered to us and how much we tried. But equally, of course, in the peaks of both waves, I think numbers were so overwhelming that it was impossible for staff to provide the humane level of care that they would ordinarily strive to. And that is, I'm absolutely certain, the root of much of the trauma people are still experiencing today, that we wanted to hold everybody's hand and knit them all a heart and read all of them their letters from their loved ones and make sure all of them had enough care and attention to feel like a human being who was loved and who mattered. But we just couldn't necessarily do that for everybody. And the act of trying but feeling as though you're failing is, of course, you know, the root of moral injury and a great deal of distress in healthcare workers. But maybe the act of trying also means something. You might not be able to do it for everybody, but if you can try, and if you can provide fragments of humanity in this dystopian, dark world, that means something too, and it's important.
Well, it is so important, and it and you've recorded that deep humanity that was around you. And you talk about, though, the kind of the moral injury that people are left with, this feeling that they weren't able to deliver the care they would have liked to have delivered. Is that a feeling you were left with, Rachel?
Yes, in the second wave, it's so January, really, January, February of this year, which was so much worse than the first. I think I experienced a kind of crisis, I think, in my own mental health that crept up on me almost without me realizing, and it manifested. I was feeling incredibly stressed. I think partly by what we were all seeing again, and actually the knock-on effects of caring for COVID patients were so terrible for non-COVID patients, because we are a finite workforce and we were stretched so thinly. So everybody, it felt as though everybody was receiving substandard care. I found in January, one day I was driving to work as usual, and I all of a sudden had what I even knew at the time it was a panic attack, but it felt as though I was having a heart attack. I couldn't breathe, I had chest pain, I was kind of stricken, absolutely. I had to pull my car off the road. I couldn't physically drive, and I was sort of shaking and clutching my chest and crying and sobbing, absolutely bereft by the side of the road. And it was almost as though my mind was trying to get me to work, but simultaneously my body had mutinied and had prevented me from doing that. And it was a really awful experience, the like of which I'd never had in my life before. And I managed eventually to calm down and get to work. And I did tell my boss, and that was very helpful, talking about it. And we sort of, she talked about her own, how hard she was finding it as well. And I did sort of pick myself up and carry on, as you always do. But I then sought help, and I was able to talk to a counsellor, which was enormously valuable for decompressing and just being able to articulate some of the trauma. But I know that I think there are two things for me that I find particularly stressful. I've realised one is the moral injury aspect of not being able to do more for patients, but the other is the kind of madness of feeling as though you are bearing witness to something that's actually unfolding, that's terrible around you, that could be prevented if different decisions were happening, you know, at a higher level that is far beyond anything you can control. If we had locked down earlier, if children hadn't gone back to school at the start of January. And I think, I'm not sure if everybody is the same, but I personally find it deeply traumatic, that feeling of knowing as a healthcare professional that I am seeing tragedy unfold before my eyes. But there are very, very powerful institutions and people who are denying the lived experience. I think that is a cause of great trauma for me as well.
Thank you for sharing that, Rachel, and I'm sorry to hear that things were so difficult, but it's almost natural that they were, because we've read what you were dealing with, and then you were going into the second pandemic as well. So it's not surprising. I suppose what's very moving to me is that you were able to reach out for help, and you got that help, and it sounds like it made a big difference.
Yes, and I guess preceding that episode, there was a period when I didn't feel able to do that, or maybe I just didn't want to do that, where, you know, probably from at least the start of December onwards, I was barely sleeping. I always develop insomnia if I'm stressed. I was having 3 or 4 hours sleep a night, nightmares, worrying, sort of that increasing sense of dread and desperation that it's happening again. Why can't people realize? Why can't I stop this happening again? People are going to die again, just like they have. This is all unfolding. I had all of that, but just carried on until, for me, that crisis point when all of a sudden I was so just startled by my body's physical refusal to go on, really, that I had to do something about it. And I think for me that I realized that if I didn't seek help, I wouldn't be able to carry on. And I don't know what would have happened. So I was very apprehensive, but actually from the very first conversation I had with a professional, I was already a little bit stronger, simply through the act of being able to talk to someone about it, because you can't talk, as discussed, to your family, you can't bother your colleagues, they're going through the same thing. Who on earth do you talk to? And it was crucial for me. And, you know, I would recommend it to anybody who is feeling like they can't reach out. For my experience, it was absolutely, I almost want to say life-saving. That's a slight exaggeration, but it enabled me to feel like a human being again.
Well, thank you for sharing that, Rachel. You mentioned your family there, and I did say there were bits in the book that made me feel tearful and be tearful, and some of those bits were when you brought your family in, but it was really valuable and really helpful. And you talk about your husband and you talk about your children. And I remember one of the exchanges in the book, it's in chapter 6, and your daughter is really upset. I think you're probably guessing what I'm going to say, but your daughter's very upset, and she says to you, why do you have to be the one that sees all the coronavirus patients in the hospital? Why can't it be someone else who doesn't have children? So if they died, it isn't so bad. And I thought that just captured something wonderful, something wonderfully important about what doctors up and down the country were experiencing, and mothers up and down the country were experiencing. And I wondered whether you could say a little bit more about it, the kind of conflict we have as healthcare workers between work and family.
Yes, it's one of the hardest things, isn't it? Even pre-COVID, that awful dilemma between your duty to your patients and your duty to your family, and working late into the evening, night after night, and knowing that you're not putting the kids to bed, or you're stressed and snappy with them because you're so tired from work. I think that's ongoing and incredibly difficult for everybody I know who has a family. But COVID did introduce this layer, I think, of guilt, certainly on my part, and toughness, because although I never really believed I was going to die from COVID, you just can't allow yourself to go there. I was very worried about bringing this disease that could be fatal into my home and to my husband and my kids. And when your daughter looks you and asks you a question, as she did, the essence of which was, why are you prioritizing your patients, who you don't even know, above me, someone you're meant to love more than anyone else in the world? That was her question. And I could see the affront, the anger and the disappointment, the letdown on her face when she asked that question, which just pierced me to the core. It was devastating. And I felt as though the one thing I owed her was an honest answer. I could have sort of fobbed it off and said, I have to, we all have to, but I didn't have to. I had asked to move to the hospital and treat COVID patients. And so I tried to explain that I was trained to help and I needed to help these patients because they needed help, and I believed that she would do the same thing if she were in my position, and I would be so proud of her if she did. I tried to be honest about it, but I don't know if that reassured her, and I don't know if I will ever successfully resolve that tension between working for patients and being there for your family. I think it's unbelievably difficult. There's a happy ending to that though, which is that soon after that, the kids just got so totally bored of COVID. They weren't the slightest bit interested. And when the second wave arose and, you know, it was back to being in the hospital, etc., they just couldn't care less. They thought it was the most boring thing in the world. And I can't tell you how wonderful that was, that it was boring. That was so much better than it upsetting them.
Absolutely. One of the things we have seen in practitioner health is that more women than ever have registered for the service. And there is some suggestion that women have been even more negatively impacted by the pandemic in health. And one of our wonderings is this related to the conflict between their work or their training and the increased care and responsibilities. And I suppose one of our thoughts, and it'd be interesting if you've got thoughts about this, is how can we stop the pandemic setting equality back really within medicine and health?
Yes, it's a good question. I mean, I was just reflecting on that as you described that phenomenon and wondering if, has it affected women disproportionately, or are male clinicians finding it harder to be honest, maybe even with themselves, about how they've been affected? Really difficult to know because my experience is anecdotal, but certainly you know, I know colleagues from both sexes who have been absolutely in bits with the experience of COVID. I think that what typically happens in a big upheaval, a big disaster, catastrophe, sadly, if you look at global catastrophes historically, is that power tends to consolidate power in a catastrophe, and things change in ways that are not necessarily progressive or revolutionary or conducive to building a better world. I know that there was talk about all of these things happening when the pandemic began, which to my mind was partly because we are an optimistic species. We have to believe in and hope for a better future, and when everything seems to be falling apart around us, Of course, we needed a narrative that was filled with hope and positivity, but I'm not sure history demonstrates that. And so it's a very important question to keep in mind, really. And I know that's not an answer to the question, but there were lots of ways in which pandemic management was detrimental to various social groups. So, for instance, pregnant women were having to go to all their antenatal appointments and sometimes endure part of their labour alone without even a partner present. A baby, even a newborn baby, was counted as another person. So if a mother went out with her baby or young child, she wasn't allowed to socialise with anybody when everyone else in the population was allowed to socialise with one other person. There are all these examples of where social groups were overlooked. And I think Black and Asian and other minority ethnic groups are, of course, another huge important example of that. I don't know what the solution is, but the first step has to be incredibly mindful of that and looking and investigating the ways in which inequality may have been heightened, and hence how you address that.
Thank you, Rachel. I know we've got some questions in the Q&A building up. I am going to be cheeky and ask you one final question, please. So I really want to know your view on this. We're finding, and recent studies are finding for health professionals, that they're drained, exhausted, they're suffering, and many are telling us they're thinking of leaving their jobs. Would you have anything to say to them about that, Rachel?
Huge empathy and no surprise whatsoever. I have a huge number of friends and colleagues who are thinking along the same lines, thinking that they can't carry on like this. It's really difficult because even if in theory your workplace is meant to protect you from conditions that inevitably lead to burnout, horrible understaffing and so on, in practice they don't, because you can't just leave the patient in front of you. It's incredibly difficult to do that. And if you do, you're still not protected, because then you have all of the guilt and potential moral injury of knowing that you walked away to preserve yourself. So huge sympathy with anybody who feels like that. In my own experience, I find trying to do something about an impossible situation is one way that I am better able to cope with it, even if it feels like it's futile. You know, it's a little bit like all the demonstrators at COP26 trying to do something to prevent climate catastrophe. It can feel so hopeless, but when you give up and when you stop believing and hoping you can change anything, it's game over. So I think I try and do something, even if it's small. I mean, literally, even if you're thinking like that, write a letter to the CEO of your trust, telling them why you feel like that and saying, you need to hear this, you need to know how I'm feeling and why I'm feeling like this, and you need to have me in so I can tell you face to face, because I'm not the only one. We're all feeling like this and you have to do something about it. Now, it's hard when you're feeling broken and ground down by work, but if you love your job, and I think most of us deep down think it's the most wonderful privilege to be a doctor or a nurse or another healthcare professional, maybe fight for it. What have you got to lose? Even if you spend 5 minutes writing that letter, or going to see the head of HR or the medical director or whoever it might be. And also, that's fighting for it, but try to protect yourself. Get in touch with PHP or your occupational health department. Talk to someone about it, because there are always ways to do things differently, I think, always.
I'd agree that there are always ways to do things differently. And it's been a privilege to talk with you, Rachel. And what I'm going to do now is let Anne let everyone else talk to you and ask their questions. So thank you so much.
Pleasure.
Thank you, Richard. There may still be, don't go too far away, because we may want you to get involved in the conversation as well. Rachel, I'm struggling because there are a lot of questions, and I think I'm going to take the coward's way out and do them chronologically, because otherwise I'm going to be accused of choosing some of them myself. So some of them are comments. Sarah said right at the beginning that the grief is palpable in GP land. In patients grieving for so much coming out as anger at our receptions, our staff, our team, we all know about that. We all need time to reflect. So she just says, thank you for bearing witness. It does help us all. And I guess my question is there anything you think, either of you think, can be done in GP land, as Sarah calls it, to help all of the other people who are dealing with patients, receptionists who are not medically involved, but still are in the front line? Is there any way that they can help to relieve this pressure, or you, any advice you have for them?
I think it's really hard to remember the vast majority of people out there who are grateful to you for the job you do and understand how difficult conditions are. And I say this as someone who experiences a lot of trolling and abuse on social media. And it's very easy to think that that tiny minority represents the whole. They don't. For every nasty, shouting, aggressive person walking into a GP surgery, partly because they've been whipped up into believing that GPs don't do any work by the Daily Mail, there are hundreds of people out there who know just what a good job GPs do, and receptionists and everyone else. And it's hard to hang on to that, but know that the nasty individuals are a tiny, tiny minority, and people are not compelled to give positive feedback in the same way. You never get good news stories appearing on the front pages of papers. If there's something even slightly unpleasant happening in the world, that will always end up on the front page. So know that, and I think share it, talk to your colleagues about it. Maybe if you're a GP partner, maybe practices and hospitals, any environment, could be having a support session where everyone, if they want to, talks together about this. Now, that might not make it go away, but at least it becomes a shared problem, not something that you're going through yourself. And I think trying to focus on specifics helps me. So I keep, I have a box that is filled with all the physical letters or cards I've ever been given by patients. And I have an online version of that as well. So if I have an email or something that means something to me, I store it away in my, it's just my little folder in my emails is called Nice Things. And I go to Nice Things because actually they're not nice, they're priceless, they mean so much to me. And I occasionally will use that as a resource when I'm feeling depleted, because it reminds me of the amazing majority of people out there who are good and are not abusive and appreciate what everyone's trying to do in the NHS.
For anyone who knows me, they'll know that I call that my feel-good file. And I have one that anytime anybody says nice, in it goes to do exactly that. Thank you for that. Coming back to something someone submitted very early on before the webinar started, how can we support senior clinical staff who feel ashamed and a failure because they struggle with their own mental health? This is a real biggie. Richard, feel free to jump in on this as well, because there is a lot of guilt in the medical profession about their own mental health and about their inability to help everyone.
Richard.
Okay. Well, I think I think it's a reality that senior staff do tend to feel guilt and shame, and that's why it's so important. We have organisations like PHP and Doctors in Distress where they're confidential and people can self contact. So we reduce barriers. But I think what's happened today really with somebody as senior and impressive as Rachel saying, actually I needed to reach out for help and it was okay and it really helped. And I think the more we hear those narratives, and they replace the narratives of stiff upper lip and game face and just getting on with it, the more it will help other people reach out for help. So I think it's a slow cultural change, but it's I also think the way Rachel uses her anger is inspiring. So Rachel recognises that a lot of the problems aren't to do with her; they're to do with what's going on around her, and she tries to do something about it. And I think that's a much healthier way of doing things than if you don't recognise that and you're not comfortable with your anger, and you think it must be something about me, it must be something I'm failing to do. And lots of doctors can feel that, but it's often not right. It's often about what's going on around the doctor, much more than the doctor themselves that's affecting them.
There was an incredible moment last year during the first wave when the BBC were allowed into intensive care in UCLH in London, and one of the consultants there, a doctor called Jim Down, who is the head of the intensive care department in UCLH, so an incredibly high-powered job. His voice cracked when he was asked about his family, and you could see on national television that he was on the brink of tears. And this was widely described and talked about, and it was an incredibly moving moment. And Jim Down actually went on to write his own book about his experience of the first wave in UCLH, in which he is incredibly honest and open about his own frailties and how hard he found it and how he cried during the first wave. And I thought that was such a wonderful example of leadership. He didn't expect to nearly break down on the news, but after that experience, he still went on to reveal his vulnerabilities in book form as somebody who was the clinical lead for one of the biggest intensive cares in the country. And I wish more doctors knew about his book, because it was a remarkably brave thing for a real clinical leader to do, I felt. And he has had only the respect of colleagues for doing it. But what an example to his team.
Thank you both for that. We couldn't endorse that more. Lucy said, as a palliative care clinician, you've had to come to terms, Rachel, for you, with many patients who don't recover and sadly die. So what can your experience in that specialty tell us about how we keep going through this winter and beyond with no definite end in sight? And we, Doctors in Distress, use the term psychological PPE. What do you use in palliative medicine that we can all learn from, please?
So I think that one of the things you learn early on in medicine, but you see almost in a heightened form in palliative medicine, is people's ability to still find joy and beauty and meaning and love in their lived experience all the way up until the end of their life or the end of their consciousness. And I find that absolutely remarkable. I think it's very easy to, if you're fit and healthy, it's easy to assume that if you are close to the end and have a disease like motor neurone disease or metastatic cancer, it must be unbearable, that lived experience. It must be nothing but suffering. Whereas in actual fact, what you learn in palliative medicine is people's capacity to adapt to different straitened circumstances is seemingly boundless. And in those straitened circumstances, equally boundless is people's capacity still to enjoy precious, tiny pleasures. And the thing that coalesces around the bedside of somebody who is dying is love. That is it. That is what they care about, the people they love. It's the only thing most people care about, and it's the only thing most loved ones and family members want to try and give and communicate. And of course, it's what we as healthcare professionals try to convey when faced with a patient in extremis. So holding on to those truths, I think, is very, very powerful and important. And in terms of how that translates to the awful winter that we're heading into, and it's already awful, it's already the worst winter we've ever known, and it's only November. I think it was pretty grim, frankly, from the summer onwards. For my trust was certainly on black alert at the height of summer. It's very, very hard not to feel depressed and downcast and as though you can't keep going on because it's never going to get better. I suppose my experience from palliative medicine is it can always get better, even when it seems impossibly bad, even when you are hours away from the end of your life. It is still possible to experience something beautiful and gorgeous and full of meaning. And in fact, in palliative medicine, that's what we try and enable patients to experience all the way until the end. This winter's going to be awful, already is awful, but within that, there are moments that are good and matter and meaningful, even if it is just having a laugh or an episode of sick humour with your colleagues where you say things that you could never repeat outside of the mess because you'd be struck off if anyone heard them. There are always tiny little fragments that are good and precious and feed your soul even in the darkest of times. And we've all clung on to those through the pandemic. I know we can't keep clinging on forever, but right now I would say hunker down and look for those, and let's emerge blinking in the springtime and regroup and see where we're at. This winter's tough. We can't, it's going to be very, very hard to make things any better over the next couple of months. But let's get to the springtime when most people have had their boosters, and let's regroup and see where we're at.
And we'll come back to that. But can I also just recommend your other book, Dear Life, Rachel, where everything you've just said comes through so strongly in that message of love, even in the darkest times, for which thank you, that's so powerful. I can't say who wrote this because I forgot to write it down, but someone wrote, the beauty of your writing is in the raw emotion and honesty that comes through, something we can all relate to, but perhaps don't always have the words to express. Although writing can be therapeutic in processing the events, how do you protect your own well-being whilst doing it? Good question.
Well, I think I don't, in the sense that everything I write, I feel as though I have to write. The books I've written had to be written. Breathtaking, I wrote at breakneck speed because I had to. It kind of poured out of me. It was like a sort of dreadful, compulsive, verbal vomit of words almost. And I think lots of writers are like this. certainly for me, if it wasn't like that, it wouldn't be any good. That doesn't mean I don't go back and craft and edit and whittle away and reshape and delete half of it and change the rest. That process happens, but the initial impulse for me is something I have to respond to. And I think that's why bashing away on the keyboard is such a valuable thing for me to do, because I'm allowing free expression to something that is deep inside me and is part of who I am. And I think it doesn't matter if the words are beautiful or not. And I would urge anyone to just bash away and not worry about whether or not it's fine writing or eloquent writing. Who cares? The only thing that really matters is that it's real and it's true to you. So bash it out. And regarding protection, I suppose I very rarely tweet in anger, although that's easy to do. I always will write and set it on one side and revisit it the next day if it's an article, or if it's a book. That's obviously a very long, drawn out process. So I think for me, I kind of carve it up into two different experiences. There's the initial experience of feeling just desperate to articulate something, and that is for me all raw emotion. It's the opposite of medicine. And then there's the second process of reflecting on that and maybe deciding that I can't actually express it all because I feel too exposed. Although I think, to be honest, I think these days it's just important to be honest, and if there's risk of exposure, so be it. Maybe that means it's something that should be said. So
I'm going to interject a quick question and say, given the winter that you've just described and that people keep to, are we going to expect another book from you? I'll just leave that for you to ponder.
Not at the moment. Not at the moment. It was I definitely would like to write another book in the future, but not right now. I'm very, very happily making up to my family a lot of the time that they missed since last springtime.
Thank you, Rachel. An anonymous person wrote, as we're going into the winter with all the pressures, how have you found that, we've done that. You speak about the fear experienced by staff. What are your fears, hopes and thoughts for the winter and beyond, the future?
Well, my immediate fear, and it's not a fear about something that may happen, it is happening. My greatest cause for distress right now is the way in which, through no fault of our own, we have essentially been set up to fail patients in all kinds of ways. We are hearing those awful stories of ambulances taking 12 hours to get to a call, or a patient lying on a trolley in the back of an ambulance for 8 hours outside A&E, dying from their heart attack in that ambulance, never able to even get into the A&E department. I'm seeing patients coming in on the wards who have endured the most terrible suffering at home, in the community, who have really slipped through the cracks, and maybe again are slipping through the cracks in the hospital, because when every bit of the system is on its equivalent of hospital black alert, Opal 4, that is what happens. So we're all frantically trying to do the best we can, but we're all witnessing awful, avoidable misery and suffering for patients at the moment, because there aren't enough of us for the need that's out there. And I don't think that's entirely to do with COVID. Clearly, partly COVID is the cause, but partly that's because we went into the pandemic desperately understaffed, underfunded, under-resourced, and now we've got a sort of perfect storm of all of that coming together. So that is my greatest cause of distress at the moment. And I think what I do is deliberate. I focus on this person here now in front of me, and I try and do whatever I can, whatever little contribution I can make to help their experience of illness be a little bit better, a little bit less horrible today. If I can do something, then I've managed to do something good. I can't fix the big picture, but I've managed to do something good, and I can take that home and say, you tried and you maybe helped a little bit. And then I also write lots of angry articles for newspapers, trying to get the public to care about this, to see this, because again, I think it's easy to just I don't want to know about this, what's happening behind the hospitals. It's nothing to do with me. It's all, let me close my eyes and pretend it's not happening. I try and I urge people to look at it, recognize it, and therefore I hope, because people are good, do something about it. Probably futilely, but you try.
Thank you. Thank you for doing that. Sarah, as an aside, made a comment and said, have you thought about running for Prime Minister? But we won't let you go there just at the moment.
I have been to Peppa Pig World on many occasions, and I can endorse it, but perhaps not in the same way as the current incumbent of 10 Downing Street.
Okay, shall we move on from that? She also asked, how long do you write for at a time? Sarah's been talking quite a lot about her own writing, following your webinar that you did for us with Michael Rosen. But she says, does it ever make you tired? And how do you stop yourself from writing when, as you say, it's a vomit of words, it has to come out?
Oh, that's a good question. I like that question, because that suggests that Sarah herself finds she can't stop and maybe stays up until 2 a.m. when she knows she should be going to bed. And I fully approve of that. I am quite ruthless in a sense with my writing. I don't indulge any of that nonsense that writers who are not NHS doctors have about writer's block and so on. If I have a little tiny bit of time to write, and I definitely do not have the time to waste it, so I'm really focused. And I suppose, because I used to be a journalist before retraining, I'm also used to working in very busy, loud, chaotic environments. So if I'm on a train or waiting for the kids and my daughter's delayed from her school club, then I might just literally write a few sentences then and can do that. But I think I try to carve out proper chunks of time if I can. So I'm part-time, and on my days off from clinical work, if I can make one of those days trying to catch up with the disaster that is our life at home, and make the other day a writing day, what I really love is sort of sitting down, fueled by coffee, and immersing myself into the process of writing. And I can get lost in that, and literally, if I didn't have any other commitments, do it for kind of 16 hours. There are times when I've started writing in the evening after the kids have gone to bed, and I'm still writing at 3 a.m. and I just can't stop because I'm so desperate to articulate it. So yeah, I will just keep going as long as I can if I can get away with it. But usually it's fragmentary and combined with work and family and tricky to pull off.
Thank you for that. Your love of writing comes through as well very strongly. We've got one comment, so for a few more minutes. Lucy, this has asked a question for you, Richard, which is, Rachel's book is called Breathtaking. And she asks, what have you witnessed in your role in mental health and with practitioner health that has taken your breath away or caused you to pause in the last 20 months?
Gosh, what a good question. Well, I'd say that even before the pandemic, working in NHS practitioner health regularly takes my breath away. We meet such, such incredible health professionals talking about their work, and perhaps even more so in the in the pandemic and hearing what people are telling me about how they've managed to care for their patients despite all of the stresses, how they're looking after their colleagues as well, and that is breathtaking. That what you hear in your work, and the courage and kindness that I'm hearing from people. What else is so? I mean, I think that's the main breathtaking thing. I think in breathtaking in a different way is how much well-being's come to the forefront during the pandemic. It's something that we can't ignore anymore. It's there in our hospitals, it's there in primary care, it's there in NHS practitioner health being extended for all health and social care people. It's now in England as well as Scotland. And that is, our mental health trust has got wobble rooms all over the place now. They look like they're staying permanently. This is wonderful stuff. So that's in a different way breathtaking, but I think it's meeting the health professionals through NHS practitioner health is the most breathtaking of mine.
Thank you, Richard. And that leads to an anonymous attendee who asked, what do you think would encourage nurses and all healthcare staff to reach out for support for their own mental well-being? Both of you, either.
I mean, partly knowing it's out there and hearing people say, we know you guys might need support and we're here for you. I think, I was aware of the doctors practitioner health service for some years. I can remember starting new jobs and new trusts, getting leaflets and being aware of it as a resource. And I think that perhaps other groups are just not aware of anything that is specific for them, which of course now PHP is. So almost proactive education, from the Royal College of Nursing, other groups at HR, to highlight this resource. Because if you don't know anyone who has been helped in that way, you just may not think it's something that could be for you. So that's part of it. I don't know what you think, Richard.
I'd absolutely agree with that. I also think that that a real good predictor about whether somebody will come through to help is whether their managers are encouraging about those kind of well-being conversations, and whether their colleagues are able to do that. I noticed that Rachel, before she came to help, talk to a colleague, and a colleague kind of said, well, I've been feeling similar, and they thought together, and I think that's so important that we're in a culture where we can talk about things. We know this is very, very common, and it's normal, it's natural, and so we need to be talking about it and encouraging people to come through to help, and encourage people to come through to help early, so they don't come through to help. It's fine to come through to help when your body mutinies, but if we could get into a culture where people come through to help at the earliest opportunity, that would be even more wonderful, I think.
Let me thank you for that, Richard. Jill Wilson has a question and then one final comment. Jill says she identified with your Rachel, your doctor and mother dilemma so much, always wondering if we have the right balance. She has two daughters who qualified as doctors in the pandemic, and she's super proud of them, of how they stepped up. So she thought your answer to your daughter was spot on, but she wants to know if you would feel, how you would feel if your children were now about to go into medicine, knowing all that you know.
Well, despite everything, and by everything I mean NHS underfunding, understaffing, the fact that our hands are tied in so many ways and we're prevented from providing the care we want to, plus a pandemic on top of that. Despite all of that, I adore being a doctor. I love it to bits. I want to be a doctor for as long as I possibly can, before I'm too old and forgetful to be safe anymore. I would be enormously proud of either of my kids if they chose to go to medical school and were able to get in. I would also be very, very worried about their well-being for all of the reasons we've just been discussing. I would be, I know that when I became a doctor, I was 10 years older than most of my medical student contemporaries, and I'd already experienced the world of work for a decade. But even with that background, although I was assertive in some ways, I just had no ability to sort of stand up. I didn't know how to say, I'm only meant to be working these hours. I'm staying 4 hours a night every evening beyond. It didn't seem possible, the culture, to stand up and say, this is awful, and it was awful. I want to believe that by the time my kids might be thinking about medicine, this momentum that Richard's just talked about now around well-being will have moved, a decade further on, and hopefully all of those individuals who still exist in the NHS around and say, you have no idea how lucky you have it. You should think about my day. Boy, was I a real brave, ballsy doctor with my 120-hour weeks. I hope that they may have all retired and actually well-being won't just be a hashtag, it will be meaningfully embedded in the day-to-day working practice of all of us in healthcare. And so my fears would be unfounded. And if they're not, I'll just have to do something about it. But fundamentally, what a gift being a doctor. It is the most extraordinary job in the world for me.
Thank you for that. I promised that we'd end at 7 o'clock, and who knows where this time has gone, but it's almost there. Rachel, in your book, you say it's okay not to be okay. It's okay to find it hard. And I wanted to highlight that, because that's what we've been talking about, that your really powerful words, Richard, your way of highlighting and bringing out what so many people are going through, and so much richness that you've talked about. I can't begin to thank you enough, but we need our healthcare professionals to know it's okay not to be okay, to admit it, to reach out for help. We run support groups. Ours are not therapeutic, they are preventative. If people can come and join our groups, we may be able to help and relieve the pressure. PH is there. Richard, you have spoken so eloquently about the work you do, and both of you, the love that you have for medicine. And I think that, for me as a non-medic, comes across so strongly. I can't bear to think that people like you all across the UK are being put under pressure without being valued and thanked and looked after. And I hope people do that as much as they can. I want to remind you also that we are going to carry on doing book clubs through, not just up to the Wounded Healer, but beyond, because we think it's a really good forum for people to talk. So I want to thank you both from the bottom of my heart, and on behalf of all of my colleagues as well. Thank you for writing. Thank you for giving up your time. If you are a healthcare worker and you need help, please sign up for work for any of our groups. And of course, I wouldn't be doing my job if I didn't say, if you are able to, please support us. Please make a donation. It would mean the world to us. I'm going to leave the last word for, firstly, you, Richard, and Rachel. I'm going to let you close us. Richard, last word.
My last word is just thank you so much. It's a wonderful event, and thank you so much, Rachel, for bringing such honesty and truthfulness to the event tonight.
Rachel, your last word.
My last word is good luck, everybody, as we go through this most taxing of winters, and know that if you are feeling like you can't go on, like it seems impossible, it's a struggle, you don't know how to keep going, the reason you're feeling all those things is because it is monumentally hard, your job right now. It's not because you're weak or failing or useless or any of those things, although I certainly have thought all of those things many, many times in the past. It's because objectively the job you're trying to do is unbelievably hard right now. So reach out to colleagues you trust, friends, and get some help. You can almost guarantee that everyone you work with is secretly feeling the same.
Thank you. Thank you both, and thank you for giving up your time. I wish everybody a very good evening. Thanks for joining us, and hopefully we'll see you again at the next one at the end of January. Good night.
Thank you. Bye-bye.
Bye-bye.